loving memory of a dear colleague and friend, Dr. Sana Diaz. And it so happens that it is exactly 10 years ago, in September of 2004, that we lost her. Sana's motto is sustain, aid, nurture, and assist. And we are modeled after and established in cooperation with ISUOG Outreach, really the true source of inspiration for us. What our goals have been are to take ISUOG's teachings and identify the needy areas in our own backyards though. We're not going to all the great places, the needy places all over the world, but locally we have many back home. We try to deliver care and at the same time try to train the local care providers who are there locally. Give you some background information on Lebanon. Lebanon is a country of great contrast. It's a country of much beauty, and it is a country of great resilience. We have approximately 4.6 million inhabitants, and our latest statistics show in 2012 we had 62,000 deliveries. Though over 96% of our deliveries are attended by a skilled healthcare provider, we still have needy areas. According with the millennial goals, we did manage to decrease our maternal mortality rate from 140 to 107 per 100,000. However, these numbers are really expected to worsen now with the Syrian crisis and the influx of refugees that we have in the country. And just to give you an idea about this problem, these are statistics from the 4th of September from the UNHCR. Today we have approximately 1.2 million refugees that are registered. We expect the same number that is unregistered, so they are over a third of our population. Just in the last week in August, we had 8,000 refugees enter. They are all over the country, but there is a huge majority in the north where Sana is. And ironically, before that, we have Ms. Angelina Jolie, who is the UNHCR Special Envoy to Lebanon. She has been there 3 times, and on her last trip in February, she stated that Lebanon has the highest per capita concentration of refugees of any country in recent history. It is also hosting more Syrian refugees than any other country in the world. This is in February. The problem is much graver today. Ironically, most of these refugees in the north, at least where we are being housed in Akkar, which is our neediest, most underserved area in the entire country. This is why we have partnered with great international and local partners. We work closely with MSF, UNHCR, World Vision International, as well as various local NGOs and hospitals. What our goals have been mainly is to go out to the needy areas, carry out medical missions, and these medical missions are crucial for us to identify where we can train providers. This has been the greatest challenge for us. We strengthen our relationships with the local NGOs and providers to identify the trainees. We have a fully equipped mobile clinic. I call this our magical box. It has everything you can imagine in it, from a glucometer to a hemoglobin tester to a scale, all sorts of medications. And we have a portable, simple ultrasound machine, which is a probe that we hook up to a laptop base. It is adequate. It doesn't have Doppler or vaginal capabilities, but it serves the purpose. And it has allowed us to carry out our missions anywhere you can imagine. This was a mission in the local home of a mukhtar, or the designated person in the village. We've carried them in homes of worship, in health clinics, in schools, and we face many challenges, not to mention bathroom challenges when we go out. During the medical missions, we do education, and it is a great learning experience for us. For me, it is eye-opening to see the comments of my daughter, who is with me today and who has been with us many times. On our last mission with the UNHCR, her comments to me later were she was really amazed at the number of children caring for children, the suffering on their faces, and the various breastfeeding practices that she heard them talk about, where women were helping other mothers breastfeed other women's children. We keep extensive data on our patients when we are on a medical mission, not educational mission. When we're training, it's very difficult to do that. I'll share some of the data. And just very quickly, to give you an idea, the majority of our outreach is in the Akkar region. Out of analysis on 669 patients, you can see that a third of them are Syrian. This has really changed over the past 3 years as the number of refugees being integrated into the population increases. And just an idea about the type of patients we see, 46% are on the 4th pregnancy or more, 38% are in a consanguineous marriage, and most of these, their offspring do not have problems that we can identify by ultrasound. 53% have had no prenatal care or one visit in pregnancy. The majority have had vaginal deliveries, but surprisingly 28% have had cesarean births and 19% have had home births. These numbers have drastically increased again with the refugees. We've identified many medical problems, but sonographically we redate roughly 1 out of every 5 women. And this is very important with postdatism, especially in the circumstances that these women are living under, not to mention fetal as well as amniotic fluid and placental abnormalities. As to the educational missions, we always provide patient education as well as provider education. The biggest challenge, like I mentioned, was identifying the trainees. We started with 2 local trainees in the Dhanniya and Akkar area. We reached the 4th and the 5th step of ISUOG training, but again, could not complete all. Our success story is really in the remote area in our mountains in the Dhanniya, where there's a team of 12 midwives and nurses that do 2/3 of deliveries. It's a hospital that has roughly 70 deliveries a month. Between August and April 2012-2013, we were going out twice a month, providing didactic sessions, hands-on training on the machine they have in their clinic. We completed the ISUOG 6-step approach to sonography. We carried out a practical exam, and certificates were awarded to 9 out of the 12 trainees. These are a highly motivated group. We now go out every 8 to 10 weeks for follow-up. We're trying to enhance their skills and introduce new skills. They, by themselves, made the first sheet for their very primitive reports, but then they made their organized, typed printout sheet. And because of their dedication, the hospital director has now allowed them to open their own clinic where they're offering free care to Lebanese as well as Syrian refugees. And I'm going to leave a message from one of the trainees.
My name is Rabia Alam. I'm a midwife in Excerpt Governmental Hospital. Our hospital is located in an area far from the city. We see pregnant women not followed medically as well. Since a year and a half, Sana Medical NGO, represented by Dr. Reem Abu Rustum, gave us continuous training on the follow-up during pregnancy by echography. As a result, we followed the ALARA principle, and we are now able to identify the ISUOG criteria, which are number of embryos, vitality of the fetus, position of the placenta, quantity of the amniotic fluid, calculating the baby weight by measuring the fetal femur length, the parietal diameter, and abdominal circumference. Also, we are able to detect some birth defects. Thank you, Sana. Thank you, ISUOG. My name is Ra.
The team is advancing further, and now we've just gotten the approval from the director to use the main ultrasound machine that is in radiology, and hopefully we'll start with vaginal training soon. We've just started a new project, but it is at the border, the Lebanese-Syrian border, in a very unsafe area called Wadi Khalid. This project, you'll see, started on the 22nd of October 2013 and is still not completed. I cannot anticipate when, because the area is very difficult to reach. These are the routes that we travel. I usually go alone because I don't want the team to travel with me, but you can see that we have deserted long stretches of road. We cross the border. Interestingly, he has on his car written, Mashi bi Nur Allah, I am driving in the light of God. So we pray when we go out to Wadi Khalid. We've had to cancel many trips because of safety concerns. But it is an amazing team. It is a health dispensary where they have about 7 deliveries a week. It is a team of 10 midwives and nurses, and you have no idea their passion and their excitement every time we've had a session. They are very eager for us to continue with the training, and hopefully we can continue with that. We've learned quite a bit the role of the local partners, the importance of patient word of mouth, and patience with many frustrations, many that we heard about this afternoon. We have great challenges that we faced. First and foremost is identifying the appropriate trainees to have a successful, sustainable program. Sometimes relocation, marriage, engagement, they may take out one of the midwives or nurses out of the health department or program that she's in. Language has been a barrier in educational material for us. Changes with the refugees and having to adapt to these changes, funding, of course, and not to mention political unrest. And just an example, we had to cancel a trip last week on the 2nd of September. I received an urgent email from my husband, stop SANA activities. But being the resilient Lebanese that I am, we were back out on the 9th of September, carried out a mission with MSF, and had the chance to encounter the magnificent Abdelaziz, a 10-year-old refugee who was with his deaf-mute mother, helping us communicate with her. In the future, well, we are uncertain where the future will take us, but hopefully we are focused on trying to identify future trainees, utilize our unique observations on two populations. We have a lot of data comparing Lebanese and Syrian refugees, and hopefully we can put those to good use, work on Arabic educational material. And I'm happy to say that on the 9th of September, we did submit the second trimester guidelines translated in Arabic. Hopefully those will be put to use all over our regions of the world. And as impossible as our battle may seem with respect to improving maternal status worldwide, as hopeful and bright as we should be, this is basically through the dedicated people that you all are here, ISUOG, of course, and ISUOG Outreach. They have really unified the globe from Haiti to Ghana to Somaliland to Singapore to Mongolia, and now we're a satellite in Lebanon for them. And hopefully, the way I see it is each one of us can serve as an ambassador in his own country to really serve as the link to carry out ISUOG's outreach mission, each one of us in his needy area right in his backyard. None of this would be possible without all of our supporters and our generous donors, at the forefront of which is the Bobst Foundation New York, and of course, ISUOG Outreach. I thank you.